Welcome back to EmpowerND podcast. This podcast creates space for honest conversations about health, well-being, and community resources to help people in southwestern North Dakota live healthy, full lives. The EmpowerND podcast is produced by Women Empowering Women, a nonprofit organization dedicated to connecting, supporting, and educating women to help them become the best versions of themselves. To become a member or learn more, visit wewnetwork.org. Maybe you have delayed an appointment because you could not get time off work. Maybe you have skipped a prescription because of cost. Maybe you have sat there not even knowing where to start or felt overwhelmed trying to navigate the system. The truth is, access to healthcare is about so much more than whether a clinic exists. It is about whether you can actually use the care in the middle of everything else you're balancing. Today, we're talking about what access to healthcare really means, the barriers people are facing every day, and what support actually exists to help you navigate it. Let's get started. Can you guys introduce yourselves and tell us a little bit about what you do?
Yeah, my name's Shelby Floberg. I'm a Community Health Integration Supervisor. In my role, I support a healthcare-based community health worker program through supervising a team of community health workers that are located throughout central and western North Dakota.
And I'm Allie Wanner. I am the community health worker at CHI St. Alexius, and I work with patients to help navigate the healthcare system.
Okay, so for our first question, for someone who has never heard the term, what are social determinants of health in everyday terms?
So, social determinants of health are often also referred to as social drivers of health or health related social needs. And they're just the non medical conditions that are present in our everyday environment where we live, work, play, go to school, and etc. And facing barriers in relation to your social determinants of health can have a negative impact on both your health outcomes and also your everyday to day activities. And I'll let Allie give some examples of social determinants of health that she sees.
So, some things that I see in my position would be like lack of transportation, lack of food resources, being able to afford your medications, as well as things like not having the medical knowledge to be an advocate and an active member in your healthcare.
Well, I think even just like access to computers and being able to find the right resources and navigate being able to fill out like a Medicaid application, things like that they really need and can't navigate. So, what are some examples that people might recognize in their own lives that are not something that you've already mentioned?
I would say a big one that is very common amongst just the normal person is general financial insecurity. And this can encompass such a wide range of needs, like Ali said, being able to afford your medication, being able to even go to the doctor and pay the $20 copay. So there's a lot that is encompassed inside of financial insecurity. Anything additional that you would say?
I think another one that people don't often think of is social isolation. Um, you know, it, as a society, we are meant to be amongst people, and it's not healthy to not have people around, just to relate to and to meet with. And that can really affect your health in the long term.
So, what does access to health care really mean?
I like to say that access to healthcare doesn't just mean having care available to you, but your ability to access the care. So like you mentioned, there's a lot of people that don't have access to a cell phone or access to Wi-Fi or a computer. So how are they supposed to schedule those healthcare provider appointments? A lot of people don't have access to a vehicle or the funds to pay for public transportation to even get to the facility where healthcare is offered. And we see this a lot in rural communities. It's not just the distance, but also feeling overwhelmed in accessing the healthcare system when it's not close to you geographically.
Something that I've actually noticed as a provider also is the access to the time limit, because if you have to work a certain amount of hours a week to be able to financially make it, the hours that are available to be able to seek healthcare are not conducive with meeting, that need, or being able to get a ride when it's during work hours, or getting the time off, or being able to, afford to take time off. So especially those people that really do need the access, they can't leave work to go get the access, even if they had a ride, they need the money too much to be at work to be able to leave.
Definitely.
So then they're left without being able to go.
Right.
Yep.
And we see that a lot, especially with like oil workers and people that have like, jobs out of town or travel for work or things like that too.
Yeah, or even someone that needs child care.
Right.
Being able to have adequate child care to be able to leave the home throughout the day to even go to a clinic appointment as well.
Right. So what in our rural communities is a little bit more prevalent when it comes to accessing and using healthcare that comes as a challenge?
Specialty care is a major issue in areas such as this. A lot of times I run into people that need to go to Bismarck for appointments. If they don't have a working car or they don't have the funds to go. That's a big barrier to try to get somebody to an out-of-town appointment when we really only have a handful of services that can take people to Bismarck, not to mention the huge expense that is for somebody if they're not covered by Medicaid.
Right. So when we've already talked about kind of what the barriers are, what do you guys do when it comes to those barriers to be able to help people?
Yeah, so Allie, as a community health worker, I like to refer to her as the liaison between the healthcare system and the community. So she's able to help patients navigate not only the healthcare system, but also the community resource and services system, which can oftentimes be very overwhelming.
What happens when social needs go unmet?
There's a wide range of things that can happen. If you don't have enough food, your nutrition balance isn't going to be there. Diabetics are going to stay sick. The medications that we prescribe for you can only do so much. The devices that you need to take care of, to monitor your blood pressure or your weight. Not everybody can afford those devices. If you don't have those things at home, it's hard for you to be an active member in your healthcare.
Yeah, and additionally, on kind of a more macro level, we see a big increase in emergency department utilization because people aren't coming in when they need to come in when they see those early signs and symptoms. So they're waiting till they're so bad that they have to utilize the emergency department, utilize EMS ambulance services,
Right.
which in the long run is an increased cost to the patient as well. So it's unfortunate that they have to wait until it gets that bad.
Right. And I've even seen some patients that, they didn't have a ride to go get their insulin. So then because they didn't get their insulin, their blood sugars are rising. They know they're rising, but they know that EMS won't take them until their blood sugar is a certain level. And so then they wait until their blood sugar is a certain level so that they can get the ride to the doctor.
Right.
When it would have been solved in the beginning if they just had access to their insulin.
Right.
And so it's just like a cascading effect that affects all of the departments of all of the human service areas in the end and really ultimately impacts the patient.
Right.
So when someone is referred to resources, why can it still be so hard to actually get help?
And I'll let Allie touch a little more on this since she's seeing this every day in the patients that she's referring out into the community. But the ones that I can think of right now are long wait lists and really strict eligibility criteria that needs to be met for you to even apply for these services.
Yeah, that's one of the biggest barriers that I run into. Not only that, but just lack of services altogether. Again, we maybe have, a couple of services, to take care of people's medications or transportation. Um, if those services aren't there, well, we can't help those people get to their appointments or help them get their medications or anything that they need for their health care.
So what needs can you think of that would need to change to make healthcare easier to access and actually use?
The biggest thing would have to probably be transportation. Getting their patient to their appointment is a priority, and you really can't do that without adequate transportation. So I would say there definitely needs to be a stronger infrastructure when it comes to transportation resources, not only in our larger communities, but definitely those satellite, more rural communities that are accessing healthcare in the larger surrounding communities.
I think telehealth has brought a lot of, or has opened a lot of doors in healthcare. But at the same time, like you said in the beginning, if the patient doesn't have a computer or, a cell phone, Wi-Fi, those services don't do them any good. So even though it's such a great, useful service, there's still other things that go with that. That infrastructure thing, again, that needs to be in place in order to utilize that system.
So what role do community health workers and community-based approaches play in that?
The community health worker role is able to do a lot of advocating for the resource gaps that they're seeing in their everyday interactions with patients. So Allie, along with all of the other community health workers in our program, are able to identify those gaps in resources that they're seeing and then go out to their community leaders, community-based organization leadership, and really advocate for the implementation of more resources for our community members.
Right. And so these patients, they have these experiences, and sometimes they're negative experiences, or they can't get what they need, or they've reached out and they've gone through some, jumped through some of the hoops and still not been able to get help. So how do you build that rapport with those patients to be able to help them in the future?
I think it's just taking the time to really build that trust between myself and the patient. I'm fortunate that I'm not on a time schedule like the rest of the providers are. I can bring patients back to my office again, just to have those one-on-one conversations and really get a feel for what the patients truly need. I like to call them, they become my friends, they, after a while, I feel like they trust me. And it's a lot easier to get the help that you need from somebody that you trust. And that's one of my key goals is to try to repair those relationships with healthcare.
Yeah, and something that's really unique about the community health worker role is that usually community health workers are long-term residents of the communities that they support. So they know all of the community resources. They've already done all the networking within their community. So they're able to meet the patient where they're at. If a patient is struggling and, does not trust the health care system, they're able to go meet up with the patient, let's say at the local library, at a local
Right.
coffee shop, just so the patient is comfortable. So I think going that extra step really
Right.
helps build that rapport with patients as well.
Yeah. What would you say to someone who's hesitant to seek health care?
I would say, come see me.
And I think, even knowing, like, as a provider, I still need your help. Like, I had to bring family to you to be able to help because I wasn't sure how to navigate some of the stuff. So it's not just limited to someone that doesn't have insurance or doesn't have, health care. It's anyone that's struggling to navigate the system. What does success look like in this work, both on a system level and for an individual person?
On a system level, I think the overall goal is to increase successful health outcomes. And we really can only do that by not only addressing the conditions that we're diagnosing, but also the conditions that our patients are living in every single day.
On an individual level, nothing makes me happier and more proud to see one of my patients be successful in their own healthcare. Whether that's, bringing their A1C down, finding their own transportation for an appointment, or, learning how to navigate the Health and Human Services or the Medicaid system. That's a big win for people when they feel like they have control over their own health care.
Right. And even just scheduling an appointment, being able to navigate the building itself and know where to go and not feel like they're lost. I think all of those are still successes.
Definitely.
No success is too small.
Yes. So what is one thing you want someone struggling to access healthcare to know right now?
I would want them to know that there have been a lot of changes in the recent years when it comes to healthcare and their focus on social determinants of health. There's a lot more supports in place to help them navigate the healthcare system, but then also when they leave the healthcare system and they're out back in the community again. So whether that be a community health worker or a social worker, or a case coordinator, there's a lot more roles in place to help support patients who are accessing the healthcare system.
We're kind of looking at the bigger picture of healthcare in smaller sections, and whatever the patient's need is, there's usually somebody there to help them. They just need to ask those questions and get the help that's available to them.
Yeah, and I think it's important, especially in our community, we are really fortunate to have so many healthcare facilities and so many physical therapists, so many mental health workers, so many, clinics, all of those different aspects where they have a lot of choices and they have a lot of areas to go to for different specialties too. So if they're not finding what they need, at one place, they can go to the other place, and knowing that all of those healthcare professionals all hope and want them to get the care that they need and that they're looking for. So just knowing that there are other places that they can go, for each service. Because I think that sometimes it's hard for people to navigate when there's a wait list or they can't get in for a while, and our community is pretty fortunate to have so many resources for them and places to go.
Definitely.
Okay, so as we wrap up today's conversation, I think the biggest takeaway is this. If you have ever struggled to access healthcare, you're not alone, and it is not a personal failure. So if you're listening and feeling stuck, this is your reminder that support exists. Shelby and Allie, thank you for the work that you do and for sharing your insight with us today. And to our listeners, if this conversation resonated with you, share it with someone who might need it. Until next time, stay informed, stay empowered, and we will see you on the next EmpowerND podcast.